Yeah, great. Thank you very much, Kyle, and thanks to everyone. I appreciate the invitation to be with you today. Let's see if I can do this properly. Are we seeing this?
Yes.
Yeah. Okay, great. So Kyle asked me to talk just about 20 minutes to kick off a discussion. I know there are many people on the Zoom on the call here or the conference that are familiar with this and are working with it in their own workplaces. But what I'd like to talk about in the next 20 minutes or so are life and death at work, what we see in terms of normal times under capitalism, what current times are, which means that the added burden of COVID and climate change, both heat and wildfire smoke, and then how workers can work together to protect themselves, which is really the key, obviously, if we're going to keep safe and healthy. So as many people know, the International Labor Organization puts out an annual tally of workplace injuries and illnesses around the world. So this was the latest one that they had issued prior to COVID, which of course started in early 2020. So you can see it was almost 2.8 million fatal accidents and illnesses around the world, which means that 7,600 workers die every day on our planet. And in Asia, where most of the global supply chains are based, it's more than 5,000 workers a day die. About 340 so-called accidents. Most occupational health professionals don't refer to them as accidents because accidents sort of implies that they could not be prevented, that they were just an accident. Typically what people refer to now as incidents, because incidents have causes and they also have solutions to prevent them in the future. And about 160 million people worldwide have occupational diseases and die from them. And about 161,000 people die from hazardous substances alone. Here in the United States, we also have an annual tally of deaths on the job. And in 2019, before COVID, it was more than 5,000 people were killed, or at least reported killed, because everybody knows it's underreporting even for fatalities, let alone for injuries or illnesses. So that amounts to about 15 people a day dying in this country from on the job, primarily accidents or incidents. But there are another 95,000 deaths that occur from occupational diseases that were provoked by exposures that people had at work. And that's an additional 260 deaths per day. So in the United States today, in 2021 or 2019, 275 workers were dying every day in our country. And almost all of these were preventable deaths. So in addition, of course, there's tremendous, as we live in a country that's stained by racial inequality, there's no reason why workplace deaths should not also, and injuries have the same impact. So death rates are significantly higher for workers of color in our country. In 2019, the death rate for Latino workers was up 14% from the previous year, 2018, and this is during, of course, the Trump administration. In 2019, the number of deaths for Black workers was the highest it had been in 20 years. And this, again, is prior to COVID. So in normal times, you would think that it would be a bad business practice to actually kill off the workforce that are making the products that you're selling. And in fact, the insurance industry has done numerous studies over the years and determined that for every $1 that employers spend on safety actually generates $3 for them in higher productivity and higher profits. So the fact of the matter is the business case, as it's called, for health and safety is indisputable at this point. But there are many employers that just say no, and it's a short-term, the short-term answer for that is the money, that what they're interested in is maximum short-term profits. And it's also an ideological aspect to saying no too, because for many employers, control of the workforce, control of what decisions are made and who makes those decisions is critical in their mind. It's also, in addition to looking at these immediate causes, I think that to take a step back and look at what's the big picture for workplace health and safety, which is the big picture for our economy and our society as a whole, And that is that, corporate profits, which employers are so keen to maximize, represent really taking, or what's called the appropriation of the wealth or the surplus value. These are all Marxist or socialist terms that are created by workers in nature. There's only two things on our planet that create wealth. That's workers and labor power and nature. Capital in and of itself actually does not create any wealth at all, though of course they think of themselves in that way all the time. Also, the primary goal of the 1%, as it's now popularly known in the United States, or the ruling class in Marxian terms, is really the accumulation and control of profits and wealth, the accumulation and control of capital. And this is what dominates our economy in many different ways, and health and safety is one of them. And it's counterposed, in the classic Marxist idea of class struggle, to the struggle of working class people to basically survive in these economy, in the society, and in these jobs, and to secure the resources that they need, as we need as a society, to really thrive. So as a consequence, to look at the current times, in addition to whatever the normal wear and tear, which we were talking about earlier in terms of massive deaths and injuries and illnesses around the world, there have been some really impactful changes in the last 2 years. The impact of COVID-19, of course, I think everybody's familiar with. You don't need me to talk to you about it, but it accelerates all the inequalities that we see in capitalist societies, particularly in the realm of exposure prevention, who gets to be the preventive measures to keep exposures low, who gets the treatments when they get sick, and then who gets the access to the vaccines. I mean, it's a really shocking, unacceptable development in the last week that they're talking about third shots for people in the United States, when literally 98% of the people in Africa, the continent of Africa, don't have one. But we're going to have third shots for people in the United States, which is a question of vaccine inequities that the World Health Organization and many others are talking about. The second big impact over the last couple of years, which also you don't need to talk about here in California at the moment, are the impact of climate change, which are killer heat waves that are affecting places like Portland and Seattle, which have never seen the kind of heat that has existed in the last couple of months. Likewise in the Southeast, and wildfires and smokes. And we've also seen tremendous adverse, severe weather in other parts of the country in terms of flooding, thunderstorms, tornadoes on a level that, because of climate change, we've not seen before, and that affect working people not only as workers on the job trying to deal with these, but also as citizens and residents. And so the impact of COVID and the climate change have made the underlying problems, which are really the capitalist system that we've had to deal with here, all the much worse. And it's also been evidence to see how the control of the workplace and the drive for maximum profits, maximal capital accumulation, really, it means that capitalism is a health hazard in a real sense. Here in California, I went back to Cal OSHA for 7 months as what's called a retired annuitant from September of 2020 till the end of April this year, to try and help out with a tremendous backlog of cases that Cal OSHA was experiencing. And one of the biggest problems that we saw were the healthcare providers, such as Kaiser, who were a real health hazard to their employees, and that Kaiser in particular refused to acknowledge that this was an airborne disease, refused to acknowledge that this was transmissible through airborne methods. And so as a result of that, they literally for months and months and months denied adequate respiratory protection to frontline healthcare workers of all varieties, doctors, nurses, environmental, cleaning technicians, the people that check people in, administrative. All these people were exposed to really high levels of COVID exposures and were denied healthcare preventive measures such as effective respirators or social distancing that was effective, ventilation systems, etc. In the meatpacking plants, same story, is that in addition to workplaces where you had tremendous exposures because of the close nature of the work. There was a complete lack of effective prevention controls. There weren't respirators that were effective. There wasn't social distancing. There weren't barriers, physical barriers, ventilations, none of this. And in fact, the line speeds in production were actually increased during the pandemic under the Trump administration's proposal, which was carried over into the Biden administration, though it's been dialed back a little bit, but not actually controlled. Farm workers, as we know, were denied protection in the fields, both from heat and from smoke, and that many of these productive enterprises, depend on farm workers who are, in addition to being really lowly paid and tremendously vulnerable, are also oftentimes the most vulnerable populations because of their immigration status. And so heat protections, even though we have regulations here in California, were routinely ignored by growers and farm labor contractors who are their direct employers. And smoke exposures now in many parts of the Central Valley in Northern California are a big issue for farm workers whose employers, want the fruits and vegetables harvested now. And of course, it has an international aspect to all of this as well. We've been working for the last 5 years with grassroots worker and community organizations in Dhaka, Bangladesh, following the collapse of the Rana Plaza factory, which killed 1,100 people in an instant in 2013. We've been working with 6 organizations that are doing a big health and safety project with primarily women garment workers. And these garment workers in the last 3 weeks have been forced back onto the job despite shutdowns for the rest of the society, despite a surge in the Delta variant in Bangladesh and very low levels of vaccination in Bangladesh. And this is similar to other global supply chains. The automobile companies, for example, are complaining that they don't have the chips they need to build cars. And it's because the factories to build those chips are located in areas of very high levels of COVID exposure, deaths, and illnesses. So just with that as the background, I just wanted to give sort of a brief discussion of for everybody who's works and is trying to figure out how to protect themselves and their coworkers on the job. How is this really best done in California or anywhere else in the United States, or for that matter, around the world? One thing is to understand that there are really 3 key players when it comes to occupational safety health. The first is the government, which of course is supposed to set regulations which protect the health and the safety of workers in all industries throughout the economy. Secondly, our employers that are ostensibly supposed to comply with these regulations to protect their workforce and comply not only with the written programs that are required, but also in guarding equipment and equipment safety measures and in the actual work practices. And the third key player are the workers. The workers have to have a meaningful, genuine participation in developing and implementing these health and safety programs that the employer has developed to respond to the government regulations, because without worker participation, there can be no effective health and safety programs on a factory level, whether that factory is in Los Angeles or in Dhaka, Bangladesh. And the underlying concept that's really key is that prevention is really what we're trying to achieve. Prevention of exposures, prevention of incidents or accidents, prevention of illnesses and injuries. In the scientific world, there's a thing called the precautionary principle, which basically for scientific researchers, you want to not do anything that you don't know what the end result will be if it means that there could be a health and safety hazard. So the principle here is that unless you can understand and know how to control the health and safety hazards, you should not be doing whatever it is that you're doing. So in the real world, of course, workers only get the rights, such as safe workplaces, that they're strong enough to take. In many places around the world, including California, unfortunately, a lot of these laws and regulations are pretty words on paper. They're not actually implemented by the employers, and workers are not able to, in any meaningful way, ensure that their workplaces are safe and that the laws are actually obeyed. And so there's some important sort of arenas of contested territory, really, between working people and the employers and the government. And that's important to keep in mind when you're trying to develop a plan for any given workplace on how you protect yourself. And those arenas of contested territory include the shop floor, the shop wherever it is. It might be an office, it could be a warehouse, could be a retail store, but the shop floor in general. And also the unions, where people are lucky enough to have a union. Of course, in the private sector, only 7% of workers in the United States today have a union. And of course, the unions are of various qualities, which we can certainly talk about. But what it means in the United States today is 93% of the private sector workers do not have a union. And that is itself a real big health and safety hazard. A second arena for contested territory is legislative and regulatory agencies. OSHA is a good example of that. It's better or worse, depending on who is running the agency, who's the governor in Sacramento, and who the workforce is in terms of doing the inspections. Thirdly, there's a contested territory in judicial courts, because many of these health and safety regulations end up in the courts, and the judges are not deciding these in a vacuum, but rather deciding them within a political context that we can influence. And also the court of public opinion, which is really an important aspect for anybody who's trying to protect their health and safety as a worker or change the regulations and the way that works. And then lastly are the international interactions. All of these economies today are interrelated with one another. So if you have bad working conditions in one part of the world, that gives the employers an excuse or the way to claim that they don't need to improve working conditions where you are, because they can always move the shop or the job or the plant to wherever the working conditions are least costly to maintain. So it's a big important concept to understand that as part of improving health and safety on any given factory, in California, for example, it's very important to support the efforts of workers around the world to improve conditions in their factory, because they're connected. That better working conditions in the developing world will bring better working conditions in the United States and other developed countries. So in my experience of both as a union organizer with the Steelworkers Union in Alabama, and as a worker, I was a production worker in Alabama, production worker in Georgia in chemical plants that were Teamster organized, and also in garment factories in Georgia as well. And so what I learned from that experience, which was actually before I became an occupational health professional, it was one of the motivating factors, having worked in a steel mill and in garment factories and chemical plants in Atlanta, Georgia, that health and safety was an important element. That's why I decided to go back to school and actually get the training necessary. But what I learned from doing the work on the ground as a production worker, and then obviously seeing it as a OSHA inspector over the last 20 years, is that the workplaces where workers are organized are generally much safer and healthier places to work. So if people are working in a location where there is a union, then it's really important to work within the union to establish a health and safety department. This can be done on a regional or district level, as well as a national level, or at least dedicated staff from the union whose responsibility is health and safety. Also, the union can provide member education on OHS regulations, that's occupational health and safety regulations, and where worker rights are. 50 years ago, many of the unions had political education committees, which unfortunately were done away with over the last 50 years. But 75 years ago, the union movement had political education or member education committees and locals that would talk about things about regulatory health and safety issues, how laws and regulations are made, how they can be influenced and the like. It's not out of the question the unions could do those again if the members were united and demanding their union do so. So working with your union is one important area to start. And even if you don't have a union, you can still work with coworkers on the job. And I think to do a couple of important things. One is that in many workplaces, that even if they aren't union, study groups have been formed by workers to actually try and figure out what are the regulations in California or anywhere else that apply to the workplace where they're at, that apply to the jobs and the hazards and the exposures they have. And it's also possible to form, in some cases, it's actually required by law in states like Oregon, for example, to have a worksite committee on health and safety, even if there isn't a union on site. And for activists, especially socialist activists, this is be an important arena for people to participate in, both to improve your own health and safety and also to build the ability of the committee to influence the conditions at work. So, for example, the collective action, which is really the key, even if you have a union, you don't, in my experience, individuals have been much more effective when they work together in collective action. That's the whole point of the union, of course. But even on a regular, issue of health and safety on a shop floor, it's much better not to do this alone, but to work with your coworkers. And some of the things that have been done to make, I think, effective OSHA complaints or to make an impact on jobs, health and safety, largely in society, have been to collect information on the hazards that exist on the job, on the exposures that people have in their various different departments and production processes, the injuries and illnesses that have been experienced by workers on the job. So collecting that information is really important. Secondly would be, for example, to circulate petitions to the employer. OSHA, as we can discuss later, if anyone's interested, is tremendously understaffed at this point. And so the ability of the agency to actually respond to worker complaints is quite limited. But we've seen situations where workers with a union or even without a union have circulated a petition demanding that the employer take actions to protect their health and safety in various ways, with the threat being that if the employer doesn't respond, they'll have no alternative but to file a complaint with OSHA or other government agencies. And oftentimes, frankly, the threat of a OSHA inspection is more powerful than the actual inspection itself. Thirdly, of course, workers collectively can file a grievance through their union on health and safety. That's one of the key elements in any contract or collective bargaining agreement, is the ability of workers to collectively file grievances on issues such as health and safety, which are covered not only by the collective bargaining agreement, but also by national and state labor laws. Fourthly, people can file a complaint with OSHA in California or federal OSHA in states that are covered by Fed OSHA, or there are about half of the states, about 25 states have their own state plan, like Arizona, Washington, Oregon. All of them have the ability to receive complaints from workers and do inspections and investigations based on that. And then the last two, of course, are what we would do in any case, really to build a campaign, because a campaign pressure is what's needed in order for people to influence their employer. So, for example, if people at the same time they file a OSHA complaint, also let the news media and the public at large know that these complaints have been filed despite the efforts of the workforce to work with the employer to improve these conditions. It enhances the pressures brought to bear on the employer to fix the problem, to make it go away if they care to, or also it enhances the pressure on OSHA to do a better rather than a worse inspection. And then, as in other campaigns like union organizing, it's also possible for the workforce to go to elected officials for support, which again adds pressure on the employer, adds some pressure on the OSHA to do its job properly. And there are a number of regulations that OSHA has undertaken to deal with a number of these hazards that we're talking about today. These would only apply, of course, for those of you that are in California, but similar regulations exist in the state plans, particularly Oregon and Washington, Arizona, which are good state plans. Fed OSHA, unfortunately, and some of the other weaker state plans do not have as many regulations, but it's worth talking about if with your coworkers on the job here in California to see how these would apply in your workplace. So, for example, this is Title 8 of the California Code of Regulations. That's what the CCR stands for. And these would be the kinds of things that a worksite committee could actually collect information about, or set up a study group to look at how would these regulations apply in the workplace. That would be the basis as well for actually looking to file complaints with government agencies such as OSHA or Cal OSHA. So Title 8, Section 3203 relates to what's called the Injury and Illness Prevention Program, which is the basic health and safety program that all enterprises, all workplaces in California are required to have, both public and private sector. So it's an issue where the employer needs to set out in its IIPP how it's going to protect the health and safety of its employees. The second one, 5199, is apropos of healthcare settings in particular, but also jails and prisons. It relates to, it's called the ATD, or Aerosol Transmissible Disease Standard. This is the standard which all of the citations against Kaiser and all the other healthcare hospitals that have violated the health and safety regulations in 5199 are being held account for. There's also in California an emergency temporary standard on COVID called 3205, which applies to everything else that's not a healthcare facility, that's not jails or prisons. Another couple of standards, the last three relate to people that are working outdoors. And it could be farm workers, or it could be construction, could be landscapers. And these are 3457 relates to field sanitation. What that means that people working particularly in the fields have a right to have toilets on site, have a right to have drinking water and hand washing facilities there. 3395 is the heat illness prevention program. That's, again, would apply not only to farm workers, but also to construction, landscaping, anybody who's working outside. And then lastly, a new regulation related to wildfire smoke, which again applies to geographic populations that are affected by wildfire smoke, construction or farm work in Northern California today, for example. And there are many other hazards that are covered by Title 8. But this is just an idea of things that people could work on in your workplaces, to work collectively with your coworkers to understand what the regulations are, how they could be applied, and how complaints could be made if the workers wanted to do so. So I'll leave it at that. That's sort of a basic primer on occupational health and safety as it looks from the big picture down to the workplace level. And I'm more than happy to offer my opinions based on the experience I have. And I'm sure there's lots of people here that have had their own experiences working on health and safety issues here in California, as well as other parts of the US and the world. Thank you.